When does a PSA test result requiring a prostate biopsy? Imagine you're getting a routine checkup and your doctor orders a prostate-specific antigen test. You might wonder, when does that number mean it's time for a biopsy? Well, a prostate biopsy is usually considered when your PSA level is elevated beyond certain points that suggest a higher chance of prostate cancer. But it's not just about one number. Your age, family history, race, and other health factors all play a role in the decision. Typically, if your PSA level is 3 nanograms per milliliter or higher, your doctor might suggest further testing. If a repeat PSA test confirms the level remains above 3, they may recommend additional steps like imaging or checking other biomarkers. Levels below 3 usually lead to monitoring rather than jumping straight to a biopsy. Because PSA can fluctuate due to benign causes like infections or prostate enlargement, doctors often want to see if the level stays high before proceeding. In recent years, advanced imaging techniques like multiparametric magnetic resonance imaging are increasingly used before deciding on a biopsy. If the MRI shows suspicious areas, a targeted biopsy can be performed to sample those specific spots. If the MRI looks clear but PSA remains high and other risk factors are present, a systematic biopsy might still be considered. Risk factors such as age, family history, race, and overall health influence the decision too. For example, men at higher risk might start screening earlier, around age 40 or 45. If PSA levels are very high, say above 50 nanograms per milliliter, it could indicate advanced disease, and doctors might weigh the risks and benefits of biopsy carefully. It's important to remember that the decision to biopsy is always personalized. Doctors weigh the chance of finding significant cancer against the risks of unnecessary procedures. The biopsy involves taking small tissue samples from the prostate to look for cancer cells and determine how aggressive the cancer might be. This helps guide treatment options. Current guidelines emphasize that PSA testing is a tool to identify who might need further evaluation, not a direct call for biopsy. Additional tests like MRI and biomarkers help refine the decision, aiming to detect clinically important cancers while avoiding overdiagnosis. Always discuss your individual situation with your healthcare provider, who can interpret your PSA levels in the context of your overall health and risk factors. Remember, each person is different, and medical decisions should be tailored to your specific needs.